Joining me now is Florida Governor Rick Scott. Governor Scott, good morning to you, sir.
Good morning. When are you going to move back? The weather's better
I know.
here.
It sure is.
Income tax, first day of spring training. There's lots of reasons to be in Florida.
I hear you. I hear you. Let me, though, let you respond to Governor Christ, who that was about 10 days ago on my show, is making the case that you haven't fought hard enough to get the Medicaid expansion. What say you?
Chuck, the first thing I did when I came into office was we revamped our Medicaid program to make sure it's a program that our state could afford and our citizens get taken care of. Now let's look at what's happened with Obamacare. We have 300,000 people that were told that they could keep their insurance, and now last fall they're told they're going to lose it. We now have basically Medicare being rated for Obamacare. As I travel the state, we have seniors all across the state that are saying, gosh, Governor, I can't get my Medicare doctor anymore. And now with these rate cuts, what's going to happen is they're going to make it harder. The administration's even acknowledged it's going to get harder to get your doctor, get the hospital you want to go to. So the Obamacare program is not working in our state. People are losing their insurance. And now our Medicare recipients who have relied on Medicare are losing their doctors.
Well, let's unpack. We got a lot of things to unpack here. Let's stick first to Medicaid. The specific charge by Governor Christ was you have not done much to actually push. You said you wanted to expand Medicaid under the Affordable Care Act to get these folks. Obviously, the Florida legislature essentially turned you down. Are you going to go back to them? Do you still want to expand Medicaid in Florida?
Chuck, what I said was when I received the waivers from the federal government that it allowed us to improve our existing Medicaid program so our citizens get better Medicaid, I said, while the federal government is going to pay 100%, I won't stand in the way of the legislature wanting to do more. But the legislature made the decision. Okay, we have three branches of government here.
Right.
The legislature made the decision not to go forward.
So you're really not for expanding Medicaid. You're just would be okay to sign the bill if it came to your desk.
What I'm saying is while the federal government is going to pay 100%, then if the legislature wants to go forward, I will be fine with that. But what I'm focused on is affordable, accessible health care, quality health care for our citizens. And what we're seeing now at Obamacare is people are losing their insurance, they're losing their doctors, and it's the opposite of what the president promised.
Now let's talk about your Medicare here a little bit, because we sometimes have to unpack. There's Medicare, the government-run health insurance program for seniors, and then there's Medicare Advantage, which is different. It's a private insurance program that the federal government helps to subsidize. Medicare Advantage has cost the federal government a lot of money. This has not been a good deal for the government. Almost majority of the so-called Medicare cuts come from Medicare Advantage. Is this a program that you think works well, considering that it has been the faster rate of growth when it comes to the cost of the federal entitlement program?
Well, let's think about our seniors, Chuck. They relied on Medicare. They relied on the Medicare Advantage program. It helps families all across our state. You know, a lot of those individuals, they can't afford what the increases that they're going to see in their premiums. But the biggest thing is they thought they could keep their doctor. They can't. They can't. They've said, the administration said, look, the provider networks, which means doctors and hospitals, you're not going to be able to see the ones you want to see now. We're going to restrict that. So it's going to impact our seniors. They were promised something, and now it's being taken away.
Well, Medicare Advantage, though, is not Medicare. I mean, you acknowledge that it is two different programs.
But Chuck, it's a program paid for by our government.
Medicare Advantage is not. Medicare Advantage is a private insurance company that gets some dedicated private insurance program that's dedicated to Medicare recipients, but it's not fully a government program.
Right, but it's primarily paid for by the government. And people have relied on it. They were told that they could keep their doctor, keep their insurance, and now what they're being told is, no, that's not true. You're not. I mean, we're already hearing that as I travel the state, seniors are saying to me, I can't get my doctor anymore. And now with these rate cuts, that basically it's just a raid of Medicare on behalf of Obamacare, and it's going to impact our seniors that have relied on this program. It's a government program that they've relied on.
All right, let me move on. I'm curious of your reaction to some of the public polling that's been out there. One says 54% say that you do not deserve re-election. There was another poll that said that asked to rate the job performance of Governor Charlie Crist in office. He had a 63% approval rating, sort of where people were remembering. With you, it was the split was 45-46. Why do you think Charlie Crist's days as governor are being remembered more fondly than your current days as governor?
Well, let's look at the facts. While he was governor, the state lost 832,000 jobs. Unemployment went from 3.5 to 11.1%. Dramatic increase in state debt, and borrowed money to pay for unemployment insurance. The private sector, based on we've cut taxes 24 times, we're going to cut taxes another $500 million this year. The private sector's come back in our state, 462,000 jobs. So my job is continue to do what I've been doing for the last 3 years, make sure all families can get a job. We have 282,000 job openings. Look, I know what it was like. I lived in public housing growing up. I remember when my dad lost his job. I remember when he got his car repossessed. I'm trying to make sure that never happens to another Florida family.
I want to just go, but what do you think accounts for this perception issue? I understand you wanted to go and go compare your two records, but the perception is something that you've got to overcome. Why do you think it's out there? Why do you think he's remembered more fondly than your current tenure as governor?
Chuck, I'm not a pundit. My job is to focus on families. I worry about families just like mine growing up. They need a job. They want to make sure their kids can get a great education. We've dramatically increased funding for K-12 education, highest funding for our universities and state colleges in history, because our economy's turned around.
Let me ask you two other quick issues out there. There's some Will Weatherford, the Florida Speaker, is talking about getting a bill that might hit your desk, a version of a DREAM Act, if you will, for undocumented immigrants that are under the age of 18. Would you sign something like that? That would allow them in-state tuition, that would allow them access to in-state tuition?
Chuck, as I've said all along since I've been governor, I think tuition is too high. We've seen dramatic increases in tuition. So I said I will certainly look at that. But I want to make sure that in 2009 and 2007 they passed legislation in the state that allowed basically a 15% increase a year in tuition. It's dramatically increased our tuition, and plus a CPI increase. We've got to stop that. We've got to make sure that all citizens in our state can afford the higher ed.
Well, let's go back to the dream. Go back to the sort of this DREAM Act style of bill that could end up on your desk that would give essentially undocumented immigrants, non-citizens in Florida, but who were brought in as children, access to in-state tuition. Would you sign a bill like that?
Well, Chuck, as I've already said, I'll certainly look at it, but I want to make sure we get tuition for everybody as low as we can get it. I want to get rid of the 15% differential and the inflationary increase. I already got all of our state colleges that have 4-year degrees to do $10,000 4-year degrees in areas where there's jobs. I want to reduce tuition. There's people like me growing up that I had to pay my way through school. My wife did. I want everybody in our state to be able to afford education.
All right, but what about the in-state tuition? Would you do this? Would you sign that bill?
I said I'd certainly look at it.
Okay, and very quickly on what Governor Brewer is going through in Arizona, do you think she should sign or veto that bill?
Chuck, I've not seen that bill. What I'm focused on is they've got some spring training teams out there that I want to get back to Florida, but I have not seen that bill.
And if she signed a bill like this that made it as if a lot of businesses would feel as if they might want to do business in Arizona, you would, as governor of Florida, would you go and raid those spring training teams using that bill as an excuse?
Well, look, I go after spring training teams. I go after companies all across the country. I'm competing with governors all across the country to bring more jobs to Florida. But again, Chuck, I haven't seen the bill. I just want all the spring training teams to be back here, though. First day of spring training today.
Do you think a bill like that, religious beliefs, should be used as a basis that of denying services to a gay couple?
Chuck, I haven't seen the bill, but I can tell you I'm trying to recruit companies every day to our state.
All right, Governor Rick Scott, I will leave it there. Republican from Florida, which you have much better weather.
Move back home, Chuck. You'll love it.
I was just going to say, you have much better weather there than what I have behind me this morning. Thank you, sir.
All right, see you, Chuck.